Good afternoon. My name is Larissa Wiltshire and I am a member of the class of 2021 at the University of the West Indies, Mona. Today, I will be presenting a literature review on Article 5 based on Behavioral Guidance for the Pediatric Dentistry course. Article information. The title of the article is Dental Fear Anxiety and Dental Behavior Management Problems in Children and Adolescents, a review of prevalence and concomitant psychological factors. The authors are Gunilla Klingberg and Anders G. Broberg. The name of the journal is the International Journal of Pediatric Dentistry, Volume 17, Issue 6. The date of the publication is the 11th of October 2007, and the type of article is a systematic review. The major topic is dental fear anxiety and dental behavior management problems in children and adolescents. The main purpose of this article was to examine the literature published from 1982 to 2006 and to evaluate prevalence of dental fear and anxiety, DFA, and dental behavior management problems, DBMP, in children and adolescents and their relationships to age, sex, general anxiety, temperament, and general behavior problems. Dental fear is a reaction to threatening stimuli at the dentist. Dental anxiety stems from a thought that something terrible is going to happen during dental treatment. Dental phobia is a severe type of dental anxiety characterized by increased anxiety. The criteria for a diagnosis of a specific phobia are 1. Marked and persistent fear that is excessive and unreasonable. 2. Exposure to the phobic stimuli which almost invariably provokes an immediate anxiety response. 3. The person recognizes that the fear is excessive or unreasonable. 4. The phobic situation is avoided or else endured with intense anxiety or distress. Dental fear and anxiety, DFA, refers to strong negative feelings associated with dental treatment among children and adolescents. Dental behavior management problems, DBMP, refers to dentists' experience when treating the patient if they display uncooperative or disruptive behavior. These images depict dental fear versus dental behavior management problems. In the first image, the child is afraid of dental treatment and is therefore crying because they don't know what to expect. In the second image, the child is being held by their parent as they throw their arms towards the dentist and towards the father. The differences between dental fear and dental behavior management problems is that dental fear is based on how the child feels, and dental behavior management problems deals with how the dentist perceives the child's behavior in the dental chair. A broad search of PubMed database was performed using specific search terms. The search was limited to publications in English, including children aged 0 to 18 years in studies published between 1982 and 2006. Abstracts were reviewed and relevant publications were identified. Editorials, case reports, and publications on intervention and treatment of dental fear anxiety and dental behavior management problems were excluded. Papers with defined endpoints for dental fear anxiety and dental behavior management problems and easily retrievable results on prevalence were used. Studies on prevalence with fewer than 100 subjects and referred groups of patients were excluded. Studies which included fewer than 50 individuals and those that did not have well-defined measures of general fear anxiety, general behavior problems, or temperament were excluded. 46 relevant papers were identified. The references of these provided an additional 6 papers. Of 5 studies, 1 reported a positive relationship between dental fear anxiety and general fear. Fear is a normal reaction for young children in new situations. An uncooperative behavior can be an adequate reaction for young children in situations where they lack control. Pain, discomfort, and anxiety are abstract phenomena which require advanced cognitive skills and control of emotions that a young child is not mature enough to fully manage. Dental fear anxiety and dental behavioral management problems affect approximately 9% of children in normal populations in Australia, Canada, Europe, and the United States of America. It was shown that dental fear anxiety and dental behavior management problems overlap partially, with 27% of children with dental behavior management problems also showing dental fear anxiety, and 61% of children with dental fear anxiety also showing dental behavior management problems. DFA, differences by age. Murray et al. Found higher mean scores on the dental anxiety scale in the group at age 12 compared with age 9. Thompson et al. Did not find a different prevalence of DFA in their population at age 15 compared with age 18, but when comparing DAS mean scores, the younger group scored higher. DFA, differences by sex. Boys and girls were compared in the 14 populations, and 10 found more dental anxiety in girls than in boys. 2 studies did not find any differences. The first reported no differences in the total group, but higher scores in boys aged 9 to 11 years, and the second reported no differences in prevalence, but higher mean scores on DAS in girls. DBMP, differences by age and sex. 2 studies on DBMP both reported higher prevalence of DBMP in younger children. 1 study could not establish any differences in prevalence between boys and girls. The other study reported higher prevalence of DBMP in younger girls, but higher prevalence in boys aged 14 and older. This is an image of Table 1, which shows the prevalence of dental fear and anxiety and dental behavior management problems. The first 2 articles were compared based on dental behavior management problems, and the remainder of the articles were compared based on their results for dental fear and anxiety. Children at risk of developing internalizing disorders such as anxiety and depression tend to score high for dental fear anxiety, but it is more complicated with dental behavior management problems. For some children, the origin of their dental behavior management problems is due mainly to previous negative experiences with dental care. Some children tolerate stressful situations better and are not likely to present problems to the dentist, while others are vulnerable and may need more attention in order to cooperate during dental treatment. Not all uncooperative children are difficult, but may have a personality, special need, or disability that requires special attention from the dentist. This is an image of Table 2, which shows the relationships between general fears, anxieties, and general behavioral problems, and dental fear anxiety or dental behavior management problems. The first set of comparisons were based on general fears, the second set of comparisons were based on internalizing disorders, and the third set of comparisons were based on externalizing disorders. As seen in the image, different behavior management techniques can be used to encourage cooperation for dental treatment from the child. This cooperation can lead to successful dental treatment, which is beneficial for both the child and the dentist. Conclusion: what this paper adds. Dental fear and anxiety, DFA, and dental behavior management problems each affect 9% of the child and adolescent population. Several psychological factors are associated with these problems. In future studies, improvements should be made concerning study design, inclusion of more subjects, and differentiation between dental anxiety and dental behavior management problems. There is a need for better evaluation of measurements of dental fear anxiety and dental behavior management problems. Why this paper is important for pediatric dentists. Dental fear anxiety and dental behavior management problems are central in pediatric dentistry. Understanding of concomitant psychological factors is essential in both prevention and treatment of these problems. Assessment of article, level of evidence. The article is a systematic review which makes it a level 1 level of evidence, since articles were strategically obtained, assessed, and compared. As seen in the image, systematic reviews are at the top of the pyramid. This is because the articles were obtained using specific inclusion and exclusion criteria. Analysis. What question did the systematic review address? The population analyzed were children and adolescents. The outcome was the prevalence of dental fear anxiety and dental behavior management problems, and relationships between them and age, sex, general anxiety, temperament, and general behavior problems. Is it unlikely that important relevant studies were missed? The inclusion criteria was limited as only articles written in English were used. This would have reduced the amount of articles that could have been assessed because they were written in other languages. Were the criteria used to select the articles for inclusion appropriate? The other inclusion criteria were appropriate by including children aged 0 to 18 years and having defined endpoints for dental fear anxiety and dental behavior management problems. Were the included studies sufficiently valid for the type of question asked? Yes, they were. Were the results similar from study to study? Of the articles found, those which had similar methods and endpoints were compared in order to obtain information that was most reliable and relevant to the topic behavioral guidance. The articles presented similar information. This is the reference of Article 5 for the literature review on behavioral guidance. I hope that the information presented today was beneficial and of great quality and helped you to understand how behavioral guidance in the dental office can help in the completion of treatment correctly and adequately. Thank you.